Hi, everybody. Thank you for joining for the third webinar that we've done now from the MGH PANDAS program, the Pediatric Neuropsychiatry and Immunology program. I'm Dr. Kyle Williams, and today we are going to talk about our experiences in our program and some of the research around the world that impacts PANDAS and PANDAS children and COVID in general, because so much has changed. So much is different with all of our lives. And there are so many questions that we discuss in our clinic that we felt like it would be helpful to have a webinar, talk about what we know so far, and talk about, I think, the wider subject, unfortunately, which is what we don't know about how COVID is affecting our kids, and tell you a little bit about our ongoing efforts in research and in clinic to address the issue of PANDAS and PANDAS and the pandemic in general. So I'm joined today by Dr. Odor, who will discuss the research activities in our program. She's the director of research for our program, and we will go through our slides. We'll go through our different ongoing research projects, and then we'll have some time for questions at the end. So without further ado, let me share my screen here. Okay, so I hope everybody can see this okay. So just a brief overview about our program. So we are now in our 9th year. 2013, the end of 2013 is when we started. And we have evaluated many kids in the program so far, over 1,000. We see about 100 new patients per year. So the clinical demand for the program has stayed high and continues to be significant year after year. So, originally I think we felt like maybe there was some pent-up demand for a program like this, and we didn't actually know sort of how much continued interest or draw that we would see for these specific evaluations, and it's stayed high. Which is great. It's just it shows that this is still on people's mind, and I think it shows that we still have a lot of work to do as far as disseminating research knowledge and having it accepted in the wider community as well. So we are the largest PANDAS and PANDAS program on the East Coast. And, we don't compare our numbers really with the other academic clinics in the country and in the world. But, I think by patient volume, we certainly are one of the larger, if not the largest programs in the country. And then unfortunately, there are not very many clinics around the world yet. So there are a few clinics that are starting in at the Karolinska Institute. And then there are a few clinics in Italy as well. But as far as sort of established academic programs, there aren't that many in the world yet. And one of the things I think that we really take a lot of pride in, and we certainly put a lot of work into, is both treating children with these disorders and then also performing research. So we are trying to maintain sort of two fronts here, which is one, we recognize that we have to treat kids now who are coming into our program who need treatment. And we certainly have to learn more about this disorder so that we are more efficient with our treatment and that we can improve our outcomes, both on the diagnostic front and on the treatment front. And we'll talk about today basically how we are doing that. So first thing I wanted to run over is that I would say that both from my experience as a clinician and from the experience for parents in our program, this has been a really rough year. That's putting it mildly, maybe. So even the other years in none of the pandemic it's not been a picnic for anyone. But this year and the back to school period this year, there's been something where it feels like really the heat has even been turned up a little bit. And part of that was, I think, just validated from the Surgeon General report, which just came out 2 or 3 days ago. And this was sort of in response to and also drawing attention to the fact that the American Academy of Pediatrics and other pediatric groups around the country have really called and said that there is a youth mental health crisis in this country right now. There are so few treaters, there are so few kids who need treatment, and there is just so much kind of acute need that it has really created a sort of a pandemic of mental health that's superimposed on the other pandemic and parents, kids, around the country are having a lot of difficulty finding treaters if they don't have them already. If they need acute treatment in the emergency room, it's long wait times, very little bed availability for inpatient beds. And so this was one of the things that, of the many things that stood out, and this report from the Surgeon General is available on the web, and you can read it. But it's just amazing that, that the emergency room visits for suicide and suicidality have risen 51% for adolescent girls in early 2021 compared to the same time period in 2019. And if any of you have experience working in an ER or even being in an ER, you can imagine what sort of when you see an increase of that magnitude, just what it is, what that does to staffing, what that does for the patient experience for people who are really in acute need of help. It's been very difficult to manage this. And it doesn't seem like there is sort of end in sight as far as a plan to address this right now, aside from increasing the number of treaters that are available and trying to get people into the care that they need. So one of the questions that comes up a lot right now in clinic with parents is like, we're having a really rough time. Are other people? And the answer is yes. I mean, I think that it is so widespread right now that the back to school period has been difficult, and just the pandemic has gone on for longer, that that people are having a hard time. And then if you need cognitive behavioral therapy or other kinds of therapy referrals right now, the wait times, the number of people that are available in each of these areas it's hard to come by. So it's not. This is a shared experience right now, and one that we need to solve. And when we look at actually what the effect is of the actual pandemic on sort of new onset cases of, this is actually anorexia nervosa that came from a study in Canada. I'm going to let you guess where the pandemic starts on this graph, right? So they charted the number of cases of newly diagnosed anorexia or atypical anorexia for a number of months, and they had been doing this for a long time. And then the pandemic starts here, and the number of cases per month skyrockets. And I won't show you the other graph here, which is the number of hospitalizations for anorexia in the same time period, but it looks exactly like this. So not only are the number of diagnoses increasing, it seems like the referrals are more frequent, but the sort of the severity level and the number of hospitalizations resulting from that seems like it's also increasing too. So a lot of difficulty from this so far. Then I'm not suggesting here that COVID COVID infections are directly causing anorexia, but the whole gestalt of stress and probably isolation, everything is, I think, increasing just the sort of general tone and increasing the severity and the amount of these different conditions that we're seeing. This actually pertains specifically to COVID. And so one of the questions, and I'll talk about this a bit today as well, one of the questions that we get a lot and that we have ourselves is, does COVID cause new sort of behavioral and mental health problems for people? If someone is infected with COVID, does COVID actually lead to new neuropsychiatric symptoms? And on the mental health side for kids, this study just came out from the UK that was sort of looking at and they have a population database where they can look at thousands of kids at once, and they pull out age-matched cases. So they look at this graph here. Symptomatic cases as people who had a COVID positive PCR test but also had symptoms. And then they found people that had a COVID positive PCR test but were didn't know it or were asymptomatic. And they compared the lasting ongoing mental health challenges, in sadness, difficulty sleeping, anxiety of the symptomatic versus the non-symptomatic. And you can see that there's a difference here. And then also compared this to asymptomatic controls, which was a way of saying you had no symptoms and you didn't test positive for COVID. So this was sort of the healthy control group here. And again, both of these cases here, both of these conditions showed a higher percentage of lasting psychiatric symptoms compared to the folks that did not have COVID. So again, the cause here very likely is multifactorial. A number of different things could be impacting this, and that is either ongoing difficulty with taste and smell after COVID, which can really generate some feelings of sadness and depression in folks. And it could be other things too. It could be just sort of other aspects of the infection that can lead to these lasting changes. But I think what's important, that we're all recognizing is that this infection, whether it's from a direct immune reaction or just from having the infection itself, or other people around you having the infection, this dynamic is increasing the amount of sort of standing psychiatric symptoms that we're seeing in kids, at least in this study. And this probably is going to be a phenomenon that we appreciate the true sort of severity of as we get a little bit farther out in the next couple of years. So what's happening here? I think I just ran over this a little bit, but I wanted to say that the different possibilities here are that, we are having more psychiatric behavioral difficulties because there's so much stress. There's so much, difficulty connecting with people and isolation. So the environmental factors that are a result of the pandemic, but may not be actually the infection itself in a person causing these symptoms. So that's one possibility. And then the other possibility is that the infection itself causes some symptoms. And for our purposes, I think for PANS and PANDAS, what we're interested in is, can COVID lead to an inflammatory reaction that then, has some interaction with brain function and generates some lasting neuropsychiatric symptoms? And the reason that I think we are interested in this as a field is that is essentially the same model that we have for PANS and PANDAS. That infection, inflammation, or immune dysfunction, and then the onset of a new type of neuropsychiatric symptoms. So this paper just came out in one of the Cell journals, which is they're one of the top journals in the world. And I actually wanted to put this on here, not because this is what it looks like, I think, when investigations start to get serious into a disorder. And COVID has brought to bear a level of scientific progress and medical progress, technology, sample collection, disease description that has never ever happened before. So the amount that we know about COVID at this point in still a relatively short time is just far and away higher than anything I've ever seen in medicine, and the vast majority of other research physicians as well. So, we can be 2 years into a pandemic and we can have a paper like this that has a ton of, serious authors on it at various institutions around the globe and the country, and a lot of funding for it. And those things matter. And we'll talk about, again, how it kind of relates to PANS and PANDAS for us. But that is, I think, one of the reasons that we can talk about some of this data now is because it's moved so quickly. So this paper basically looked at lasting neurological effects or neurological symptoms and seeing, again, if they are secondary to an immune response generated by COVID. And the background for this is that about a third of moderate to severe COVID-19 infections do have some neurological sequelae, so some lasting neurological symptoms that were not there prior to the infection. One of them, again, that gets a lot of, I think, attention, understandably, is anosmia, so lack of smell or loss of smell, and that leads to loss of taste as well. Seizures are something that has been, defined post-COVID, and then also psychiatric symptoms that, that we talked about in the last slide. And one of the distinctions that we should draw here is that this is actually not from COVID, the virus itself, infecting the brain. Okay, so if we had a brain infection like an encephalitic virus, something that was actually infecting and damaging brain tissue, or was largely sort of resident in the brain tissue that was leading to lasting brain problems, we would expect and understand that. And it does appear that COVID, the virus itself can infect brain tissue, but it's not common, and it is very likely not at the core, not the cause of neuropsychiatric symptoms in the vast majority of patients who have these lasting symptoms after the infection. So there's some intervening process, right? There's something where there's an infection, there's a different moderator, and then there's the onset of neuropsychiatric sequelae. And as in PANS and PANDAS and as in COVID, we think that it's the immune response, some type of dysregulated immune response or overactive immune response in COVID infections is the cause is moderating this, these new symptoms. And so what they did in the study, very similar to some of the studies that we've done previously and that we're doing now, it's just moved so much faster in COVID, is look at CSF, which is cerebrospinal fluid. So this is basically, if we are looking for inflammation in the brain, then one of the best ways to do it is to collect the spinal fluid from the spine, because that is in direct communication with the brain itself. And we can look at inflammatory byproducts in that CSF. It's a lot to go through, right? So, and if we think about our patient population and kids, it is a lot to go through to do a spinal tap for kids. And so it's really not routinely part of what we do in clinic, unless we have a kid who's incredibly severe and other instances call for it. But with COVID, these folks were very sick. And so the number of people that were having neurological sequelae that were getting spinal taps because they're hospitalized or for other reasons, far higher in COVID. So when we look at sort of one of the reasons why this has progressed quickly is because they also have the samples, and they have the CSF samples to look at these different studies in a way that we still struggle in PANS and PANDAS to actually have that sample database. But in looking at the cerebral spinal fluid and the blood from patients with COVID-19 and then from controls, they're looking for what they show here, the CSF cytokine profiles. So they are looking for, do the inflammatory markers look different in the CSF if you've had COVID with neuropsychiatric symptoms versus if you have not had COVID, or if you've had COVID and you don't have lasting neuropsychiatric symptoms? And the answer is yes. So they can see clear patterns of inflammatory reactivity in those who have had COVID with neurological symptoms. They also looked for autoimmune antibodies. They haven't defined the autoimmune antibodies in this subset yet of patients, but they looked to ask the basic question of, do they have antibodies in their CSF that react with brain tissue, with their own brain tissue? Do they have autoimmune antibodies that are targeting brain tissue? And 5 out of 7 subjects they looked at did. So again, when we were talking about PANS and PANDAS and talking about a strep infection and the potential for autoimmune antibodies following that infection that bind to brain tissue, COVID looks pretty similar. Thankfully not for the vast majority of infections out there. It looks like it certainly is a subset. But PANS and PANDAS too is a subset of think of the incredible number of streptococcal infections that happen every year around the world. The vast majority of kids don't get PANS and PANDAS. So there's some other aspect that is certainly influencing or determining who's getting these lasting neuropsychiatric sequelae after an infection. There's something that we don't understand yet and haven't found, but there's certainly a lot of work that is going to go into that, because it may have an ability to predict your the risk if you have if either COVID or another type of infection, that you have something, either again a lasting sort of neurological condition or other types of sort of inflammatory or heightened inflammation from the infection. And this actually came from the same group, and this I think was just published a few weeks ago. And this is looking at autoantibody profiles now in kids. This is in teenagers, and they're publishing that they've essentially identified the presence of these autoimmune antibodies in the CSF of 3 teenage patients who had neuropsychiatric symptoms following a COVID infection. And a few of them, I would urge people to take a look at this if they have the ability to look at this paper. But a few of them had anxiety tics. It didn't look like what we see in PANS and PANDAS clearly. It wasn't like I would say that an exact match. But it's really adjacent, right? It's in the same ballpark. And one of the things that this I think does is show that this is really a credible pathway, right? This is something where from infection to immune moderator after the infection to neuropsychiatric symptoms, that this is a pathway that we've been arguing for in PANDAS for a long time. Now in COVID, it seems like everybody has taken it at face value that this can happen, which is great. And now we're seeing the evidence that it's a viable pathway. And this is from Sam Pleasure's group in UCSF, and he's done some work with I think the Neuroimmune Foundation at their talks as well. So really fantastic group of researchers, and this is really some cutting edge stuff. Looking at, hopefully we'll learn more in this process of how these antibodies are generated. Is there a way to intervene to actually block, following the infection, to block the generation of these antibodies, and hopefully then stop any kind of neuropsychiatric symptom onset before it starts. And I just wanted to show this as well. So people who've seen maybe the other webinars will know that I presented this last time, maybe even a little bit before. So we have seen these autoimmune antibodies as well in kids with PANDAS. So we took serum from kids with PANDAS. This is from, so we started this work when I was at Yale, and Chris Pittenger in his laboratory continued it with Luciana Frick and Jean Zhu, and published 2 papers out of it, which basically showed that we can identify a specific type of antibody to a cholinergic interneuron. And so you can see here that in the caudate, the putamen, these are 2 structures in the basal ganglia. We see a difference in what's the mean intensity here is essentially the binding strength of these antibodies. And it's different in folks with PANDAS compared to controls. And then when we look at a different type of neuron, what's called a PV interneuron, a parvalbumin interneuron, there's no difference in binding. So it is specific both to the PANDAS condition and it is specific to this type of cholinergic interneuron. So not so different, very likely, from what they're seeing here, although it's probably a different type of neuron, different something in that regard. And what we hope is that this really matures into some sort of diagnostic or some test that we're able to actually give to people to say who has PANDAS, and if we treat this antibody, do the symptoms get better? We have a little bit of that data. Again, this was published in 2020 in the American Journal of Psychiatry, because we looked at these folks, we looked at their binding intensity before they had IVIG therapy and after IVIG, and we saw a decrease in, so these pictures here are just showing sort of the electron micrographs showing that the binding is there. This is how we look for it. And then in panel B here, this is showing the mean intensity, the strength of the binding before IVIG and after IVIG, and there's a clear significant decrease. And that decrease is also correlated with the improvement in their CY box, the change. So when we're saying change here, we're saying the reduction, the benefit in their OCD symptoms. So there's binding decreases after IVIG, OCD symptoms decrease after IVIG, and those 2 things are correlated with each other. So there's I really hope that this, this evolves into more of an answer for folks, and that we continue to do this work to better understand the relationship between these antibodies and symptoms, and then how we potentially treat them through IVIG or through other therapies. So, but I'm just kidding a little bit here, but like you're saying, we're saying that an infection could lead to changes in behavior, like, is that groundbreaking? Like, and I am glad that people are, we have to recognize in COVID, we have to treat it. We've also been, I think, trying to get some credibility or some belief in this for 20 years in PANDAS, and there's been a lot of pushback to it. And that pushback when it comes to COVID now is gone. It was never really even there to begin with. It was kind of assumed from the beginning that COVID leads to a lot of immune difficulty, maybe autoantibodies, therefore neuropsychiatric differences. You just have to wonder, like, if PANDAS had been of a different time, would it be more readily accepted now? And I don't know that COVID kind of being here right now is going to wildly change the acceptance of PANDAS. I think we're still going to have to the science still has to be there, and the communication has to be there. It can't hurt, right? I think it can't hurt to have people recognize that this is something real. So I wanted also just to say that not only is this not the first time it's ever happened, but this was, if we look back actually, and I won't spend too long in this, but I think this is super fascinating. So there was a disorder called encephalitis lethargica that really swept, it was a type of pandemic. The movie Awakenings is about this, Oliver Sacks did a lot of early work in this. And when it hit kids in England, it radically changed the way that they were, raising kids, and it changed the way that society was essentially hospitalizing kids. And you read some of these early descriptions of what the behavioral change in encephalitis lethargica was, and it is shocking. So, this is basically a physician saying it is quite a common thing for children of tender years to be sent to mental institutions, but it's unusual for a mental disorder of such a degree as to require certification in a boy who's 10, who had previously been of sound mind. So no, previous psychiatric history. Again, they're remarking for these children that they were quote unquote perfectly normal and had been into the hospital after developing sudden radical changes in behavior. And these radical changes in behavior included a lot of aggression. So they started to call encephalitis lethargica, quote, a disease that makes criminals out of children because their behavior was so degraded and so much worse. And just the other aspect of the other quote, I think, from this that was interesting for our standpoint in PANS and PANDAS is this McPhail, this physician saying, the case stood out because the patient had previously been regarded as perfectly normal in every way until he had an acute illness in the summer of 1920. So I think anyone who has a kid with PANS and PANDAS could relate to the statement like this. And again, this is 100 years ago. And encephalitis lethargica is, for whatever reason, has dissipated. We don't see it anymore. A lot of these cases were thought to actually be autoimmune encephalitis, anti-NMDA receptor encephalitis, and were either called, again, encephalitis lethargica, or from this physician who described it, was called von Economo's encephalitis. But again, it is a clear indication that infection and change in behavior. And so not only, again, was that well described, but if we go back even earlier, so this is William Osler. He published this paper on Sydenham chorea and choreiform infections. This is in 1894. And he is arguing that Sydenham's chorea results from an infection. They don't know yet that it's a streptococcal infection, but he's arguing in this manuscript that it's not necessarily only a hereditary condition, but that is actually associated with rheumatism or illness, and that happens in children. But one of the things that he says in 1894 is psychical disturbance is rarely absent in chorea. Unfortunately, in the majority of cases, it's slight in degree, but then a frequent complaint heard from the mother is that the character of her child is completely changed. A patient may do odd and meaningless acts, and he goes on to describe sort of some compulsive behavior from a child related to numbers. Things that would, if we saw them in our patients or if we see them in our family, now we would recognize as obsessive compulsive symptoms. But again, the early descriptions of these things. So there is a historical context for these. I think that is important to note. And what we are now, through technology and everything else, we're trying to fill in the gap of what is the mechanism, what is the diagnostic ability, and then how do we intervene in this? If it's an immune mediated problem that is causing neuropsychiatric symptoms, where is the correct point to intervene to stop the progression and stop the symptoms? So with that, I want to jump into then a few slides here to discuss our clinical experience with COVID-19 and PANS and PANDAS so far. I think one of the things that we were really bracing for and curious about, and that we've heard from a lot of people, is, can COVID cause PANS? And when I say PANS specifically, not PANDAS, because again, PANDAS is only a streptococcal infection. And so if you have any other infection that's causing the same constellation of symptoms, then it's PANS. If it's mycoplasma, Lyme, viral infection, etc. So can COVID cause PANS? Theoretically, we from the beginning said yes, and we sort of expected, and actually were quite worried that we were going to see a lot of PANS-like reactions from COVID. When we heard that the kind of the level of immune dysregulation, the level of potential autoimmunity that we're seeing after COVID, but it didn't happen in the way that we really expected. We have not been overwhelmed by post-COVID PANS cases. We have seen a few that are very convincing. So I'm not going to say that we haven't seen it at all, or that I don't think in any way that it's impossible. I think it's still likely and very possible. We just haven't seen it yet to the degree that we expected. And that has mirrored a bit the experience that people have had around the country and the world too. We have, I think in general, just haven't seen the numbers that we expected. Maybe just our expectations were wrong. Although what I will say, and I think we're a bit more worried about now, for reasons that I can't explain, I've seen more kids with COVID in my clinic in the last 2 weeks than I probably have in the last 2 years. And I don't know if that's just bias from who knows what, or it's just in Massachusetts, in the local area, in kids, it's more rampant right now. But one of the possibilities that I think is a little bit unnerving is to think that for whatever reason, the rate of infection in children was lower when kids, when people were early on in the pandemic and when school was virtual, and that we're getting kids back in school now, thankfully. But maybe we're starting to see a higher rate of COVID infection now. And so the expectation that we have about PANS following COVID, that may be on the way. I hope not, but there's always the possibility that, what we expected to happen, there was just a time delay with it. So the answer for this is yes, I think, convincingly COVID can cause PANS. It's just how often is it associated with miss C or severe cases, or can it just be sort of asymptomatic or routine cases of COVID? Don't know enough about that yet. And what happens if my kid with PANS or PANDAS gets COVID? So I would say that we only have had, up until this point, probably, out of a few hundred kids that we see in our program, no more than 10 have gotten COVID. We've had a lot of suspected, but no more than 10 really have developed, PCR positive COVID. By and large, they've all been well after a few weeks. So it has caused symptom exacerbations in a lot of the kids that we've seen get COVID, increase in tics, increase in OCD symptoms. But I would say on the whole, it has not been as severe as streptococcal infections. And look, I don't know that we could say that it's going to be that way for everybody, but I think that that's the way it is right now. At least that's what we've seen so far. And we are still kind of wondering, all right, so is there any treatment that we should get if we see a kid with COVID and we know that they don't need to be hospitalized, they're medically sound, they're just have COVID, don't feel well, and may have some sort of secondary kind of inflammatory process that happens from it. Is there anything we should do? And I would say that we don't know yet. We don't have enough experience with seeing these kids and seeing what works. So we've tried some of the typical anti-inflammatory treatments that of non-steroidal anti-inflammatories. We've done that sparingly, and it seems like potentially it's been helpful, but it's hard to differentiate that from just the passage of time and the kid maybe just improving on their own. We have not seen severe exacerbations, severe flares from a COVID infection yet in a kid who previously had PANS or PANDAS that has necessitated like IVIG or any other sort of more invasive or more kind of serious immune modulatory treatment. And if we will, certainly we will start to publish and discuss those cases, but it hasn't happened yet. So that's our limited experience so far, but we are trying to collect as much data about this as possible, and so are the other, Stanford, all of the other clinics are trying to also understand how this affects our patient population, and if this brings sort of new cases of PANS and PANDAS to us. But again, I think it's not been as populous, so it hasn't been as prevalent as we expected in our population. The other thing too, I think that what we hear about quite a bit, and Dr. O'Dower is going to talk a little bit about our research efforts in this regard as well, is, if should we have our kids get vaccinated for COVID? Is it going to cause symptom exacerbations? Are things going to get worse? We, in our program and in conjunction too with our kind of the advisement that we have from Dr. Pasternak, the head of pediatric infectious disease at Mass General, we have advocated for vaccination for everybody. And by and large, the side effects that we've seen from the vaccinations have not been severe. If we sort of would correlate or kind of stack up the kids who've gotten COVID, how they've done with their PANDAS and PAN symptoms versus the kids who have gotten the vaccine, I would say the vaccine is much more mild for exacerbations on the average. We have seen some kids have a lot of difficulty from it for short periods of time, but the same is true of the actual infection of COVID, which also, again, we would be remiss in not saying that carries a lot of other health risks, right, that are thankfully still relatively rare in the pediatric population, but not zero. So a lot of other things can happen from the infection as well beyond, an exacerbation of PANS and PANDAS symptoms. There can be, side effects from the vaccination itself too. Thankfully, those also have been very low. And we have not yet, thankfully seen any long-term symptom increases from the vaccinations, from either the first dose or the second dose. We're keeping our eyes out for it. We've seen, again, some short-term symptom increases, but nothing long-term, and certainly nothing severe or permanent so far. And so the other question I think that we get frequently is, do kids with PANS and PANDAS have a higher incidence of vaccine-related side effects? And we have so little experience with this so far. And there's not a way for us to answer this question right now that wouldn't just be straight guessing or due to bias. I wouldn't think that there's a reason that kids with PANS would have a higher rate of side effects. But we're going to try to gather that information and get a more objective answer to that question as the time goes on. So that I think is to be determined, to be continued. And finally, can COVID vaccinations cause PANS, right? So we have seen previously we've seen some onset of symptoms where, someone has, we think, developed PANS or PANDAS after vaccination, potentially. We have not seen that from any of the COVID vaccines. So I don't think that there's a concern that we're going to generate new cases from PANS or PANDAS or things like that from the vaccination itself. So again, I think if we put this in context of the fact that there's another potential for a COVID infection to be severe, on whole and on average, I think we are far better off vaccinating the kids for COVID. And until we get data really that says otherwise, I think that makes sense for that to be our position going forward. So with that, I think I'm going to turn it over to Dr. Odor, and she's going to talk about some of the data collection that we're doing right now for vaccines for COVID. And then we're going to come back and answer some questions and go over a few of kind of the ongoing research studies that we have as well. So with that, this is Dr. Sarah Odor, again, who's the Director of Research for our program, and I will turn it over to her. Sarah.
All right, thank you, Dr. Williams. So thank you for the introduction, and thank you for sharing that information to help give families a little bit of direction, even though, like you said, we don't have a lot of data yet. And that's what our program is really working on, to try and see if we can get some data on that. And let's see, we can go to the next slide. Thank you. So we have been hearing near constant reports now of how the pandemic has negatively impacted physical and mental health of various communities. And so we wanted to better understand what was happening in the PANS PANDAS community, both in the kids and with their families. And so this past year, in the spring between February and June, we conducted an anonymous survey of caregivers of children with PANS and PANDAS. And so thank you to all of those who might be on the call who participated in that. We had over 600 responses. And so what I'm going to present here is just a little bit of that data from a subset of those respondents. For this data, for these analyses, I was just looking at caregivers, mostly parents, whose children were under the age of 18, and they had a sudden onset of the cardinal symptoms of PANS and PANDAS after an infection. So you can go to the next slide. And so we asked, how much parents felt like the pandemic was impacting different areas of their children's lives. And so here I have highlighted, not surprisingly, the pandemic and lockdowns were perceived to have a negative impact on children's relationships with friends and their hobbies and their academic skills. And you can see at the top too, in terms of PANS, PANDAS symptoms, it really varied, right? We heard anecdotally from families that for some kids, their symptoms were better because they weren't going to school. And so they weren't getting strep and they weren't getting symptom exacerbations. For others, certainly then they had a harder time with that. So that was a little bit more across the board. Then next slide. But this one I wanted to highlight too, because I was a little bit surprised by this. So a large percentage of respondents felt that the pandemic had a somewhat positive or strong positive impact on the relationship with their child who had PANS PANDAS. And I'll take positives or silver linings from the pandemic wherever I can get them. And so I wish it was 100% who said that, the pandemic caused them to have a stronger relationship with their child, but it's nice to hear that was the case for many of them. So it's always nice when we're looking at what are the negative effects, that potentially there are some positive impacts as well. Next slide. And so for many, the pandemic changed how they accessed medical and psychiatric care. And we've learned from past survey studies that we've done in our clinic that finding care for PANS PANDAS can be really challenging for some families. And so we wondered how that fared during the pandemic. Did that make a difference? And so for most of the population that we sampled, the pandemic actually didn't seem to make a difference in their ability to receive care for PANS PANDAS. And for a minority, it actually made it a little bit easier. We'll go to the next one. So we wondered if this might be related to the use of telehealth. So during the pandemic, use of telehealth services increased 20-fold in the general population. Other researchers showed that the increase was most substantial among adults within metropolitan areas and in counties with lower poverty levels. So given that many suspected that elements of telehealth would remain even after COVID-19, we wanted to see if families were utilizing telehealth for PANS PANDAS care and what they thought about it. So what we found was 86% of our respondents utilized telehealth for PANS PANDAS care during that part of the pandemic. The majority of those who use telehealth said that they would prefer it in the future. So I know it's very hard to see here, but the orange part shows those who would prefer it in the future or would say, yes, they would prefer it in the future. And gray here are those who don't. And across the bottom, it shows how much the child's symptoms changed during the pandemic. And that didn't make a lot of a difference. So whether or not the kids' symptoms got worse or better during the pandemic, the majority of respondents still favored telehealth. But of course, there's some caveats to that as well. So someone's preference towards telehealth depended on the type of appointment, which makes sense, and was most preferred by parents who rated their child's symptoms of PANS PANDAS as mild. And unlike what was found by other researchers in the general population, we didn't see that the results were dependent upon someone's income or the density of the population where the child resided. And so this study gave us some insight into that many families might prefer telehealth or at least see it as a useful part of their child's healthcare going forward. And therefore, it should probably continue as at least an option. But the efficacy of telehealth is something that we don't know about yet. So that would be something that would warrant some future research. And so here in this slide, this is then other results from that survey that back then in the spring, there weren't any COVID vaccines available for children. So what we asked parents was, would you plan to vaccinate your child when it becomes available? And what you can see here is that a lot of parents really aren't sure. Some were definitely on board, some were definitely not on board, but there was a lot of uncertainty. And I think if we did this now, I'm not sure how much that would change, because what we learned too is that parents wanted more information. And even as Dr. Williams was talking about now, we do have some information and some recommendations, but there's certainly more to still be learned about that. And so that's that's what we're trying to work on now. Next slide. And so we're doing another survey to look at this. And so right now we're doing it just in our own patient population. So if you hear from us about this, this is what we're talking about. We're looking prospectively to track symptoms. So similar the way, if you've gotten the COVID vaccine before, the CDC might have asked you to fill out their kind of tracker app to track symptoms as they came up, if there were any. We hope to do the same thing for kids with PANS and PANDAS so that we can see what are the symptoms that kids are having, and tracking pretty far out to see when those occur and how will they resolve and how severe they are. So then we can share that information with the general population so parents can make an informed decision. But what we also want to know is about a lot of kids are already gotten the vaccine. And so we want to know retrospectively what happened with those kids. And we also know that some parents have decided not to vaccinate their children. And so for both those who have chosen to do so and have chosen not to do so, we want to understand what helped inform their decision. Now, if you're not in our clinic, there are ways that you can help out with this research. If you are part of the International PANS Registry, Dr. Masterson at the University of Washington, her team is working on something similar, and we've collaborated with them as well so that our study lines up pretty closely with theirs as well. So if you're in that registry and you get an invitation to participate through that, it's very similar to this, where you just be answering some questions about your child and the symptoms they might be having after a COVID vaccine. So that's another way to help out as well if you're not in our clinic. It's interesting to know about this registry as well, because they do a lot of really great research like this too. And if you're interested in becoming a part of that registry, Dr. Masterson let me know that to sign up for the registry, it's in transition right now to the University of Washington, but it'll become live again at the beginning of 2021. And it just takes 10 minutes to start up and register. So if you're interested in being part of these things later, that might be a good opportunity as well. Next slide. And so I would be remiss if I didn't also mention the other studies that we have going on. So from previous webinars, you've probably heard me talk about the multifaceted approach that we take to understanding PANS PANDAS, trying to fill in different parts of these kind of puzzle pieces of what's going on, how to best help families. So we do ongoing studies of disease pathology. We use biobanking to look at peripheral markers of inflammation. We do MRI studies to better understand neurological and cognitive correlates of what kids are experiencing. And so hopefully these studies will inform new treatments. And we also want to better understand what the current treatments are doing and who do they work best for. And so we do this by tracking the patients in our clinic to better understand who is responding to what. And we're also conducting randomized control trials, looking at both over-the-counter medications and immune modulating therapies. And as I've already talked about, we also want to understand what kind of daily experiences are and what is going on in the patient population to help understand the different types of research avenues that we take. So for example, we had done a survey study before to better understand, the burden that families were experiencing. And then we checked in on that when we were doing the COVID survey and seeing what was going on during the pandemic. But then that's where we also saw that there was a lot of uncertainty about the vaccine. And so then we said, well, look, we have to collect the data from this. So we've tried to use the information that we've gotten from families about what's going on with their kids to direct where we spend our time and what research avenues we take. And so you can go to the next slide. And so if you're interested in learning more about us and the research that we do or getting involved in research, you can go to our website. If you express an interest in research, we'll send you a link to a confidential and short survey just to see whether or not you might be eligible. I want to say a huge thank you to those who have participated or reached out to us seeing if they can participate. I'm always amazed how after the webinars we've had before, I hear from so many people offering to help. And even if we don't have anything that's a perfect fit for you or your child, if you allow us to, we keep your information on file in case there's something that comes up in the future. I've been amazed at this community of people who are clearly working together for the greater good of figuring these things out. And that helps me to be motivated to wake up and do this research every day too. So with that, I'm going to turn it back to Dr. Williams, and he is going to tell you a little bit more about some of the things we have going on. And then if we have time, we're going to get to a few Q&As at the end.
All right. Thank you. That was great. So we are, as Dr. Doris said, we're trying to do our part in the fact that, when we look at kind of the autoimmune antibody work that I talked about in the beginning of the talk, that stuff, we are collecting samples for that kind of work now. And we're also trying to make sure that we collect sort of the patient experience of, so the antibodies are incredibly important. It's also just really important for us to understand how families are accessing care, how these things, how the pandemic is changing, and to try to answer the questions that we see in clinic with data that we get from, from the community of people and parents who have the disorder. So that's, a lot of this work is going to, we hope, directly inform having some sort of objective, something to hand and show people when they ask questions about, what are the rates of, how many kids have difficulty after the vaccination, or, what things do I need to think about, or after an infection. So on the way. And I just wanted to show the other thing too that Dr. Dor is, that we're both doing now. This is an MRI from the Martino Center. This actually has the distinction, I think, of being the highest resolution MRI to date, brain MRI at least. And we would love to get pictures this clear, but we usually don't have them. I'm just going to try to stop here on a part here. So we talk a lot about the basal ganglia. And these are the structures we're talking about here. This is a view top down of the brain. And so when we are doing the MRI study that we're doing now, we are trying to look for markers of inflammation in these areas here, the pallidum, the putamen, and the globus pallidus. So we can visualize these things on an MRI. What we have a much harder time doing is visualizing inflammation, because even it has to be sort of incredibly significant, severe, or damaging inflammation to see that on an MRI, and we typically don't in kids with PANDAS. So we are trying. We have been for the past 3 years in a study that was originally funded by the PANDAS Network and is now has ongoing funding from the International Obsessive Compulsive Disorder Foundation, is looking to see if we can find MRI sequences that are either specific for inflammation or that we can use to sort of back up or solidify the diagnosis in kids with PANS or PANDAS. Kids with PANDAS, this is restricted to kids with PANDAS. And then to see if there are correlations between inflammatory blood markers and anything that we see on the MRI that we could deem as inflammation. We have to do this kind of work for the imaging in kids because we can't do this in kids. So this is the result of another PET study that we're doing right now. So the difference between MRI is magnetic resonance imaging, PET is positron emission tomography. And the main difference, I think that the take-home difference is that one involves radioactivity, and one does not. So an MRI has no radioactivity in it. You can do, MRIs all day long without really any negative effects from the scan itself. It may not be comfortable. But for PET scans, we have to inject people with a radioactive compound, which is, again, it's safe. But you have a certain limit to the number of PET scans you can do for research, and we don't do these in kids for research purposes. So we have some radio tracers that allow us to look for the activation of a cell type called microglia in the brain, and this is an immune cell in the brain. So shorthand, we like to think of it maybe as inflammation in the brain, but it's probably a bit more complicated. But at the very least, it is the level of activation of this immune cell that is resident in the brain. And we are looking at that in adults with obsessive compulsive disorder, because there is some previous evidence that these immune cells are actually abnormal in adults with OCD as well. And so PANS and PANDAS may just be another sort of route to that maybe that there is a subset that's a wider subset than we originally thought, that has obsessive compulsive symptoms because of abnormal function of these immune cells. So this is funded by Fidelity Bioscience Research Initiative. We're super excited about this too, and we hope that we can find some markers here in this study that we can use in kids without the use of radioactivity. So can we take something from this PET study, because we're doing MRIs at the same time as we're doing the PET, and say, okay, this showed what we think is increased inflammation on the PET scan. Maybe we can take that into kids with MRI and see if that helps to differentiate kids with PANS, PANDAS, post-COVID neuropsychiatric infections. And if we use an immune treatment, before and after, do we see a decrease in sort of any abnormalities? So that is work that's in progress right now in our group. And I just want to say a word of thanks before we go to the questions for the funding and support that we've received, both from, so donors to our program have kept us going. There's no other way to say that. And we are so appreciative and thankful for anything. We've, one of the, I'm trying to not make this sound like sour grapes, but one of the reasons COVID moved so quickly, the research, is because there's a lot of funding in it. And PANS and PANDAS historically has not had that level of funding from, we wouldn't expect it to have the same level of funding as a pandemic, but it hasn't had a level of funding, I think, that's necessary to get the kind of answers that we are hopeful for. And so the funding and support that we've had from donors has been invaluable for that, and has kept us going. And it's allowed us then to start to sort of to game plan some studies that then the preliminary data has then allowed us to go on for larger grants, like the ICDF Foundation. Mending Minds, PANDAS Network, PANDAS Physicians Network are all nonprofit groups that have supported us, and that we and same as with the International OCD Foundation, that we are just very thankful to be have continued connection with and do a lot of work with. So with that, quickly before we go to questions, I know we're running out of time. I promise I'll stay late for questions, because I cannot, I can't not thank people for, because it would be impossible to do this without the team of people that we have. So first and foremost, Dr. Ador has, we would not have any of the research that we're doing right now, really, without Dr. Ador's work. And anyone who is better in clinic knows that she's just really an invaluable member of our team. And same with Dr. Geller and Dr. Pasternak. Dr. Pasternak is clinically seeing kids at Mass General. Dr. Geller works with us in research collaborations as well. And I cannot overemphasize how much Mary Spencer means to our program. Anybody who has called our program knows that Mary is a credit every day to our program, and keeps us organized, which is a challenge for me. So a huge thanks to Mary Spencer. Julia is a research assistant in our group right now, who is also helping with the MRI studies, and is hopefully going on to graduate school sometime soon. So we sure luck in that endeavor. Mary Trespalis is another research assistant who is hopefully going on to med school and works with the PET study. Mackenzie Schuler works with Dr. Geller and is helping us out. Hallie Geller is a medical student who's doing some work on immune deficiency and autism in our group, which we're really excited about. And then Saffron, Olivia, and Maggie of all people who are sadly have gone on, worked with us for a while and gone on, but still have some association with our group. So I wanted to name them and just say thanks for their help as well over the past 2 years in the pandemic. I'll let the other just sort of keep the screen up for the other collaborators. And then finally, just a huge thank you also to the development team at Mass General. So Michael and Catherine, Michael Johnson and Catherine Labash, who have helped us do, this is the third one now. And it's been enjoyable and successful each time. And we've gotten feedback from people that they feel like it's helpful. So we're going to hopefully continue to do this, and they make it possible. So thank you to both of them. So promise we will take, I know that we are maybe going a little bit long, but I'm happy, both Dr. Ador and I are happy to answer some questions in the Q&A if people want to queue those up.
Yes, so people always do such a fantastic job of coming up with these great questions. And I wish we had time always to go over all of these, because we also have a number of great questions from the previous webinars that we've done that we've not been able to go back and address yet. But just briefly, as I'm looking over some of the questions that have come in today, we've been talking about vaccines for COVID. But someone brought up too, what about vaccines for the flu shot this year? Have you found that, or have you heard that this year's flu shot has negatively impacted kids who haven't had a history of prior adverse events?
Sorry, I was just looking at the questions coming in too. Sorry.
Nope.
Or have
So
we
for this
seen?
year's COVID, I mean, this year's flu vaccine, what would you say about this year? Have you heard anything that for some reason this year's flu vaccine is more likely to cause flares in kids with PANDAS?
I haven't seen it. We've been so focused on and most people are spacing out the vaccinations. So meaning that they're not getting vaccinated for the flu and COVID on the same day. So most people, at least that I've seen in clinics so far, have put the COVID vaccination first and foremost and are waiting to get the flu vaccine. So I haven't seen it be terrible. What I think is, and I think there were some comments, some people saying, putting some comments in the chat about side effects that their kids have had that have been pretty significant from either COVID vaccination or others. So what I would say is that there seems to be a lot of variation. That yes, we have heard of and occasionally seen folks who have had significant side effects from these, but that has not been the experience for the vast majority of kids, both with the flu vaccine and the COVID vaccine. So we still, by and large, are telling people that I think it's a mild disruption, if any disruption at all, from the vaccinations.
Okay. And we probably only have time for a couple more questions here. There have been some questions coming in about IVIG, and I know that there were previous questions and things have changed a little bit in Massachusetts in terms of IVIG potentially getting paid for by insurance companies for the care of PANDAS. Can you just give a quick update on that?
Yeah, so thanks to the work of, so Dr. Pasternak was really involved in this. This has been a multi-year effort that has really been championed by parents. And I was involved early on, and we got close, never got there. And then Dr. Pasternak got involved, and I think we had a new influx of folks that were working on it. Sheila Gausch and some other people that really kind of put it over the finish line. So there was the bill passed, I believe, last year that was going to mandate the coverage of IVIG for PANS and PANDAS. And it has not gone into effect yet in Massachusetts. And it seems like it's going to go into effect, I believe, in January of next year. To be honest, how it actually works, we have very little information on. So is it going to be blanket coverage for everybody? Is it one dose? Is it multiple dose? How do you do it? Where do you do it? There is not, I think, any guidance in that so far, which I know is frustrating. So we're closer to having that be an option for folks if it's necessary. But there's still a lot that we don't know about it. So I think checking back with our program is important. And also Mary Spencer, and it's come up a little bit in the chat too, wanted me to say right now, by the way, we are still virtual only. And because of the guidelines that have unfortunately kind of gone back into place around telehealth, we can only see folks in Massachusetts right now. And that's because I'm only licensed in Massachusetts, and we're going to try to expand that a bit, but I have to be, if I'm doing telehealth across state lines for folks, it's just a little more complicated. Mass General right now is restricting us to understandably doing it in Massachusetts. And there's a lot of, I think, movement and interest in changing that in Congress or sort of modifying some of these rules, and we'll see if that happens. But right now we are seeing patients who are based in Massachusetts or physically in Massachusetts for a program. And I know that's limiting for a lot of folks. And we also, I think the other thing that is important to bring up, that we have some criteria for our program, for coming into our program, that we try to stick to as well. That we get a lot of requests for new evaluations, and we just simply, I wish that we could get to all of them, and we can probably get to about a third of really of what comes in each month. And we end up referring a lot of people out to try to find care at other places. And that doesn't feel great, but it's part of a, it's a symptom of the fact that we've had continued high interest for many years and have accumulated a lot of folks over the years. And so it puts pressure on kind of how many new kids we can bring in at a time.
And hopefully, hopefully in doing webinars like this and doing the research that we're doing is hopefully that can eventually expand the care that people can get elsewhere too. I mean, I think part of this is we would love for everybody to not have to come to specialty clinics like this one, right? I mean, that we would love to be able to say, yes, you can go to these other people and get the care. And so part of it is, like you said earlier, that balance of the research and clinical piece to also do the research so that we can inform these. So it doesn't have to be, with you as the physician, that it can be, other places and across the country too, across the world.
Yeah, and that I think it underscores why we spend a lot of time in research, because I think we try to have a lot of equipoise in research. We try not to be biased or have an agenda to push in research. It's best to try to design something that's as balanced as possible and just sort of let the data speak for itself. But I think I can't help but say that I think that PANDAS has gotten a bad rap. I think over the past however many years. I mean, I think that a lot of people are rejecting the idea that it's possible just sort of because they've had a negative association with it previously, or someone told them that it wasn't real. And so it's unfortunately, I think it's our sort of hill to climb, in the sense of doing the research that makes people say, okay, maybe now I'm more open to this, or this, this data is I think irrefutable in the sense of, and I think if and when that can happen, we'll start to see this be treated more, more broadly. That's the hope. And I think it's hopefully a possibility. So I'm going to jump through just a few more. I know that we're getting late on time, but I wanted to make sure that there are, we can get to a few more questions quickly. So we had a question about, let's see, if someone has no negative side effects from one vaccine, will they have no side effects from the COVID vaccine? I don't know. I wish we knew, but the COVID vaccines are different, right? The mechanism for how they work is a bit different from something like the flu vaccine. And I don't think that makes it worse or more likely to have side effects or things like that. But I don't know that it's actually as simple as saying like, it's kind of an apples to apples comparison from one to the other. So we're talking about kind of recently, are we seeing kids who the COVID increase that we're seeing, is it due to either the variants? Is it due to unvaccinated versus vaccinated? And I have not seen anybody who's had testing to tell them what variant, if they have Delta or Omicron or what, So I can't speak to that as far as a reason for the increase that we're seeing in COVID infections. And then the other question was about if they're vaccinated or unvaccinated. Majority of them have been unvaccinated because of age, but some of them have been vaccinated too. So and recently vaccinated. So it's tough to know. And there was a question here about is one vaccine better than another, or is safer than another for PANS or PANDAS symptoms? And we have zero data on that. So I would not try. I don't know that it makes sense one way or the other to sort of insist on a certain type or anything else of the vaccine so far. And maybe I think one of the ways to end, and I know we always have so many more questions that we can get to, and I'm sorry for not and maybe I think people, if there's interest, we can I'm fine to do just a question and answer webinar at kind of regular intervals. If there's interest in that, we can start to do those things too. It's hard sometimes because I think that we want to be so much farther down the road than we are in this. And so the questions are great questions. And it's sort of like, well, I wish we could give people definitive information on that, or I wish that we had objective information on that in a way that we don't yet. And hopefully one day we will. But I think one question we got, are there areas in your clinic or research which you're looking for philanthropic funding, and how can donors make an impact? So if you go to the website, and it should be hopefully in the invitation that you got, and it's in this webinar too, but you're not going to have access to it afterwards. But if you Google the MGH Clinic, so we are, we call ourselves, or we're kind of known as the PANDAS Clinic, but our official title is the Pediatric Neuropsychiatry and Immunology Program. If you Google that, that'll bring you to our webpage, and then there's a link for donating on that webpage. And a lot of times you have to write in our name, where it says like, are you trying to specifically route your funding to a specific clinic? So it always is helpful to say PANDAS Clinic or Pediatric Neuropsychiatry when you're doing that. And again, we are so grateful for anything. I think there's not a single area of our research that couldn't use, some ability to, we want to make sure that our researchers are able to have enough time, and have enough resources to be able to answer these questions, and we're not going to get stuck sort of like midway through a project. And the philanthropic support for it is hugely valuable, and we use it also to to help staff some things in our clinic as well. So it makes a huge difference for us. So again, we appreciate anything in that regard. And with that, I think we're going to say thanks again to everybody for being here tonight, and we will send out another. One last thing. If you go to our website, if you have, if you know somebody, or if you're somebody who would like to have an MRI for our study, we are looking for kids who don't have any history of psychiatric or behavioral difficulties, currently, previously, or any treatment, to have an MRI as a control group for the PANDAS and OCD folks that we have. We can't take siblings of kids who have PANDAS, so that really cuts down kind of our referral sources. But if you know anybody who would like to have an MRI, we try to do it quickly, and it's it can be a fun experience for some kids, and we would really appreciate that too. So that information is on our website. But thank you, everybody. Happy holidays, and thanks again for tuning in, and we will see everybody soon. Bye-bye.